pumpkin carving coming up this weekend, at least over the next few days before Halloween. But you have to be mindful. The slip of a knife could leave you with a very serious injury, and it can happen quickly. Joining us right now to explain what to avoid and how to do this properly is Dr. Hudson Seidel. He's an orthopedic surgeon with the Connecticut Orthopedic Institute at Mid-State Medical Center. Doctor, thanks for being here today. I see you got a pumpkin with you.
I do. Thank you so much for having me. I thought we could do some demonstration.
Well, let's start with how common is this? Do you see these kinds of injuries every year?
Yeah, so, hand surgeon myself, the pumpkin carving injuries are typically the 5th busiest time of year for us. We see about 4,000 injuries related to Halloween, and about half of those are from the pumpkin carving. You can really injure a lot of important structures on the front of your hand, such as your flexor tendons or your arteries or nerves. So they can really lead to a lot of long-term consequences for you.
And it can happen quickly, right? And I think, parents, you want to do this with your kids. You want them to have a good time, but you have to do it safely. And correct me if I'm wrong, but, one slip of the knife when you're going to put it in the pumpkin, all of a sudden you've got a very bad injury.
Right, so exactly like you said, you want to take the necessary precautions if you can. So that's why I brought a nice little pumpkin carving kit. We talk about it, it's usually easiest to go grab the sharpest knife in the kitchen, but you really don't want to do that because that really can cause a lot of significant injury. They're much sharper and they can really lacerate those tendons if we're not careful. So what I recommend is grabbing the pumpkin carving kit, always stabilizing with your non-dominant hand, and then cutting it away from yourself. So like this, as opposed to up towards yourself where you're more likely, if you slip, to end up cutting yourself or injuring yourself. And then like you mentioned, I see a lot of these happen in young kids too. So if they are going to participate in the cutting, you want to make sure they're closely supervised at all times.
Yeah, it's a very good point. Obviously, we want to be careful with children, but adults, this can just as easily and quickly happen with them as well.
Exactly. And if something does happen, the first thing you want to do is try and control that bleeding. And bleeding that's not controlled in about 10 to 15 minutes really is a high risk of having cut that artery like I talked about earlier. So you definitely want to go to the emergency department if that's the case.
I was just going to ask you.
You also want to clean it out.
Yeah, I was just going to ask you, so if you can't control the bleeding, because I think that's important, within a few minutes, you really should go see a doctor?
Absolutely. Go to the emergency department in that scenario for sure.
Boy, I hate to ask this, but, worst case scenario is sometimes folks need surgery to fix a problem from this?
Yeah, certainly. So if you have an injury of that tendon or of the nerve, those are certainly things that are going to be needing surgery down the road. And things to look out, let's say you have a laceration down the road of when to come see us, would certainly be if you have any numbness or tingling in the finger or difficulty bending it down or even making a fist. I tell people, if you're having trouble making a fist, that's really a clear sign that you need to come see us for sure.
All right, Dr. Hudson Seidel, certainly some good information. We appreciate your time, and it's interesting to hear just how common this can be. We hope you have an uneventful weekend, though, coming up, so thank you again.
Thank you.